Despite being on long-term treatment, from time to time, patients with rheumatoid arthritis will still experience episodes of pain and swelling in their joints, which we commonly call flare-ups. Today, we will discuss what is a rheumatoid arthritis flare-up, what are the common triggers for a flare-up, and how to treat rheumatoid arthritis flare-ups.
rheumatologist OnCall.com.
What is a flare-up? As I said, from time to time, even patients with rheumatoid arthritis that are stable for a long time can develop episodes of pain, swelling, and increase in the morning stiffness in one or multiple joints. These episodes can also evolve into severe fatigue, sometimes fever, or weight loss. Rheumatoid arthritis flares can happen more at the beginning of the disease, but can happen at any time. If you are in the process of changing the treatment or tapering down from a medication, then there is also a higher chance for you to develop rheumatoid arthritis flare-ups. If you forget to take your medication, or if you decide, without informing your doctor, to stop taking the medication, that can also precipitate a flare-up. The flare-up can last from a few days to a few weeks and sometimes can be very debilitating. What are the common triggers for rheumatoid arthritis flare-ups? Most of my patients will link the onset of flare-up with episodes of intense stress, or lack of sleep, or even change in the diet. Stress. Too much stress is always damaging your health. Emotional stress, like a divorce, if you change a house, if you're moving to another city, if you lose someone that is dear to you, can cause a lot of stress. Even overworking or overdoing things in the house can be stressful for your body and can lead to rheumatoid arthritis. Why? Because stress will affect your immune system, may actually induce the production of molecules that will increase inflammation and could precipitate a rheumatoid arthritis flare-up. Poor sleep. I always tell my patients that poor sleep or less sleep translates into more pain. Most patients do notice this correlation. Poor sleep was reported by many patients to develop flare-ups of rheumatoid arthritis. Diet. Many patients report that eating processed food, too much sugar, or gluten, the next day they will develop episodes of pain, swelling, and stiffness. You should pay attention to which foods are causing you the symptoms and try to avoid them. Weather. Usually, rapid changes in the weather or the barometric pressure can also increase the risk of developing a rheumatoid arthritis flare-up. People that suffer from arthritis, they can tell you when the weather will change as their joints feel these changes of barometric pressure way ahead the weather change. The fluid in their joints can become thicker and the movement is becoming more difficult. Infections. Upper respiratory infections, like a flu, can precipitate your immune system and can cause a flare-up of rheumatoid arthritis. Unfortunately, patients with rheumatoid arthritis can be more vulnerable to infections because they suffer from this disease, but also because they take certain medications. That is why I keep close contact with my patients in case they develop a flare-up to have immediate access to my practice. How to treat a rheumatoid arthritis flare-up? If you experience a flare-up, I advise you to contact your rheumatologist and discuss the plan in detail. Suppose you have a mild flare-up involving one joint. In that case, being at home, you can try topical medications like capsaicin or diclofenac. Now it's available over the counter in the United States. Or you can use acetaminophen or Tylenol arthritis until you are able to see your doctor. Now, do not use Tylenol if you know you have a liver disease, as this can cause more damage to your liver. Suppose you have a few joints affected. In that case, wait to see your rheumatologist. The treatment may be a short course of non-steroidal anti-inflammatory medications like NSAIDs. Unfortunately, patients with gastric ulcers, previous history of bleeding, or kidney issues cannot take NSAIDs as they can cause all of these side effects. You may also benefit from injections with steroids that can be given to you as a local therapy by your rheumatologist. If you have multiple joints involved, you might benefit from a short course of corticosteroids, for example, prednisone or methylprednisolone, and then gradually taper down over the next few weeks, sometimes even longer. Now, every patient is unique, so your rheumatologist or I decide for my patients what is the appropriate length of the therapy. Now, suppose that you have repeated episodes of flare-ups over a few months. This might be indicative that the baseline therapy that you are taking, for example, DMARDs or disease-modifying anti-rheumatic drugs, and/or a biologic medication requires to have dose adjustments or even change the medication. However, this needs to be discussed with your rheumatologist that will be able to answer you all of these questions. Remember, these videos are just for educational purposes and are not supposed to offer you a diagnosis or a medical evaluation. If you like the educational content of these videos, remember to like, share, subscribe, and press the notification button. Please leave your comments and your questions down below, as I will be happy to answer them the best that I can. Thank you, and I will see you soon in another video.
rheumatologist OnCall.com